right. You can hold on him.
Oh, okay.
Look, he loves you already. Okay, we saw this morning that we can also do blood pressure measurements in animals in rehab and also for our sports dogs, which can be very beneficial, not only looking at the pure blood pressure numbers, which already give us a good information, but also including pulse wave and pulse wave analysis in the future, giving us additional information on stroke volume, systemic vascular resistance, rhythm or arrhythmia. So we add on more cardiovascular parameter, which help us to condition the animals in a perfect way. I would like to get just started so you have the true impression. We use a unit, a technology which is called high definition oscillometry, which is based on oscillometric measurements as the ones you know. It's just very much faster. And so it is measuring actually systolic mean and diastolic pressures instead of calculating it out of mean arterial pressure, which gives us additionally pulse pressure, which looks like being the most important part when we look at damage to the arterial system. So we have a lot of benefit with that because it's so fast and so sensitive. We can measure at the base of the tail, also in small animals like you saw this morning on ferrets, I even measure the rats, we can measure the tiny little birds. So we are not limited to a big vessel anymore. I prefer the tail, to measure on the base of the tail for a simple reason. If we measure on the base of the tail, we can allow the dog a lot of different positions. And I also prefer that the dog finds its own position. And this dog did at this moment. So the dog decided he likes to lay down and we leave him in that position. If we place the cuff, we have to make sure that the artery is somewhere in this area. It does not matter where. It should just not be below here or here at this very edge. So just let him lay down. No problem. So the easiest thing is that we have the tube coming in at this positioning and get the tube away from the body because some animals feel distracted if the tube is constantly touching them. That's the only thing. Can we lay him down again, please? So if it's a Schutzhund, I would say Platz. I learned yesterday that you work a lot with German words. Large dogs, I always measure on the floor. I don't lift them up because they are excited by the moment they are on the table. And then I just place the cuff around the tail. I need to fix it tight, but not too tight.
No treats for Bailey. She has allergies.
Okay.
No treats for Bailey.
No problem. As soon as we have adjusted everything, we can start the unit either from here or we set everything up at the computer. We had a small dog before, so I just want to make sure we have the right presettings. We don't need that much amplification, everything, probably not such a high deflation rate. And then we just start the reading. And you can see the dog is completely relaxed. It's not frightened or excited about that. And we get wonderful pulse waves showing up. So every single pulse wave is one stroke volume arriving in the periphery, right where we are measuring currently for blood pressure. We already can see how the opening behavior of the artery takes place. We see that we have low presystolic amplitudes, a nice and constant increase to a maximum, which we want to see if we have a stable stroke volume situation. And this is already the result. The blood pressure is 144/69 diastolic, mean arterial pressure 95, the pulse is 85. So the dog is relaxed and we don't see any particular changes. If we want to measure systemic vascular resistance, we simply drag that line down here and push our button over there, and it gives us an SVR of 12, which is within the normal limits. Up to 25, we have completely normal situation. Between 25 and 40, this is the so-called gray zone. It can be excitement-induced vasoconstriction. It can also be an early onset of renin-angiotensin-aldosterone stimulation. So we have to be a bit careful if we enter this area. If we are above 40, we almost always find a disease, which has an impact on systemic vascular resistance. So this is a perfect reading of a dog, and we just do a second reading to see how the dog is reacting, being in this round, being measured by us and having so many people around. We always should do at least 3 readings in a row and average them, because we have fluctuations in blood pressure. We have animals which tend to have higher readings as the very first reading and then level out at a lower pressure range, which finally reflects their physical situation better, and we don't want to overestimate the blood pressure. After we have done the initial measurements, we can then exercise the dogs. If possible, it's ideal if we measure while we exercise, but in some dogs it's not possible because they just have too much movement also at the tail. But we can then exercise them right afterwards. So if the exercise allows it, I leave the cuff on, probably with a shorter tube than that, so just with half of that, exercise them so that I'm not losing time after exercising and getting a measurement right away. And we have a similar pressure situation in our second reading as well. We have a 143/80 and a pulse of 72. And if you look very carefully, you see respiratory sinus arrhythmia. So this dog is healthy in terms of his heart, because we want to see respiratory sinus arrhythmia. So we have slower areas followed by faster areas, and then it slows down and then fast again and so on. So which is just what we expect to see. Is anybody happy to exercise that dog for 2-3 minutes? To run outside? Jona, do you want to run?
Sure.
Let me just
What should I do?
just run the dog so that it's really exercising, and then come back and we measure him again. Probably 3 times forward and backward should be enough. Whoops.
Now, what do you do if you have a dog without a tail? Or
That's the limitation to use the tail, when I have to go to the front limb. And I go below the elbow, because above the elbow I have even more muscle mass than below the elbow. And the more muscle mass you have, the more sensitive is the reading towards artifacts, because the muscles make us the movement artifacts. So at the tail we have tiny little muscles in between the vertebrae only, and that makes it so easy for us to measure at that area without any artifacts, even if the dog is moving. We had a dog just before standing in here, and the dog was doing perfect. It moved a little bit forward, a little bit backward, but it did not interfere at all with the reading. Whereas if you measure on the leg, you could not allow any movement at all. But we sometimes have to go on the leg. And then I recommend to do it laying down. And if the dog lays on lateral recumbency, use the leg which is on the floor. It's usually calmer than the one up. It tends to wave. So just think about what is the best situation without holding too much on the dog to keep it calm. If we measure on the tail, we can let the dog stand or lay down, because we want the cuff to be at the height of the heart. So sitting is not the ideal position, obviously, because that gives us a difference of, in that dog, about 40 centimeters. And the calculation factor is 0.8 millimeter mercury per centimeter. So that would give us a completely different story of that dog. So we want him down, please, again. Can you lay him down, please?
I knew how I did.
Down. Or he should stand. It's fine too. You can already tell that the heart rate is faster. And we have a higher cardiac output. Our overall height of the amplitude is higher, indicating an increased cardiac output. At the beginning, that was movement artifact while laying down. So usually it's better to let them find their position first and then start a reading. But if you do it right after exercise, it's important that you can start early. 161/84. And we just do immediately a second one. And the same thing again, always do at least 3 readings, right, one after each other. And if you have too strong fluctuations, probably even 5. Now we have no artifacts anymore. You see the movement artifacts are gone because the dog found its position. And this is the key thing. If a dog does not want to lay down, don't force him to lay down. Let him stand. Because when you have a more relaxed animal and you have less movement artifacts. (166/77), and we do a third one. So although the dog lies here and looking completely relaxed, you still can tell that that dog is not recovered yet. The breathing pattern is much better already than it was before. So the heavy breathing is now leveling out already. We could measure the pulses as well, and you would see the same picture, or you would feel the same what you can see on the screen. But we still have, well, we are going back to the normal pulse rate now. So it's 158/68, and the pulse is now down to 78. Let's see how it's doing the next minute. So this is what we expect animals after exercising, that they come back to the normal pretty soon. We should allow a maximum of 5 minutes. Most of well-trained animals are back in 1-2 minutes to their normals, depending on the amount of exercising, of course. And we have a very pronounced respiratory sinus arrhythmia now. (144/66). We are back to normal. That's it. Thank you very much. Do you have any questions? Does anybody want to measure the dog? But if you cannot do that, definitely the older ones. The older ones, the ones with a condition which can cause high or low blood pressure. Think also about hypotension. It's not good in animals also. And then with certain drugs you should measure. It's important during anesthesia and in some operations also after anesthesia. If you think of gastric dilatation, volvulus things, for example, it's a key thing to have a look at that. And you can use it to detect acute pain, because acute pain is increasing blood pressure, sometimes dramatically. And some animals lay down like that dog without showing any signs of pain, and they are horribly painful, and others yowl like hell, but they are not painful. Sorry?
Is it just the thought that they might become painful?
Yes, exactly. So if you're not sure, does it has enough analgesics, do a blood pressure. Acute pain is reacting very aggressively on blood pressure, chronic pain not. So if you have a chronic painful animal, you see mild or no changes in blood pressure. Okay, thanks very much.
Thank you so much.